Okay, so why should we integrate spirituality into healthcare? It's a cultural fact. Patients want it. It's a resource. It's linked to positive health outcomes. It can be tied in some forms to poorer health outcomes. You can't separate it really from treatment. And spiritually integrated treatments have shown promise. The key question then isn't why should we integrate spirituality in health? The key question is what's taken us so long? Why aren't we doing more of it? Spirituality is a key dimension of what it means to be human and a vital dimension of holistic care. There's no need to whisper.
I want us now to think about the way I understand the use of spirituality. Now, remember, I'm a pediatrician, I'm a baby doctor. So if you want to see situations of enormous anguish over the meaning of the death of an innocent child for the parents and the loved ones, I mean, it's like all of the natural order has been reversed with the death of childhood. And death of children has been a particular clinical concern and care of mine. So I have been privileged to be at the deathbed of infants and children and teens, and one of the greatest experiences of my own clinical life and my personal spiritual life. So I want to think in terms of the importance then of spirituality within this range of understandings for meaning making, coping. I think there's a kind of language that we might share. And also for ethical decision making. So I want to now start to bridge the gap between the spiritual and the ethical. Both notions are notions that you heard this morning. The spiritual has come into play in medicine, medical education, nursing education, health, allied health services education. Well, ethics is less than 30 years old as a formal discipline in the health sciences. And it's not that there hasn't been an ethic in the Hippocratic tradition of medicine for over 2,000 years, but both these notions have had to be made more explicit in our time. And I want us to think about why that's so and think about the ways they relate to each other and are distinct.